Hello everyone and welcome to the Autoimmune Dietitian YouTube channel. My name's Annie. I'm a registered dietitian and I work with people struggling with autoimmune diseases. In my work with my clients, I help them use both food and lifestyle as a way to improve their symptoms and hopefully give them back their lives before they were diagnosed. So vitamin D is one of the most important vitamins in managing autoimmune diseases. And while it plays a number of important roles in the body, vitamin D levels are inversely related to autoimmune disease activity in many conditions. So today I'll cover what vitamin D is, what a deficiency looks like, and how to maintain optimal levels of this vitamin in your body. Before I jump in, I just need to attach my usual disclaimer to this video that the information in today's talk is not the substitute for the diagnosis, treatment, or care of disease by a medical provider. This is for informational purposes only. So please consult your qualified health professional for any changes you make to your medical care. Okay, so what is vitamin D? Vitamin D is a fat-soluble vitamin that must undergo two different transformations in the body in order for your body to use it. The original form of vitamin D that we get either from sunlight or food is called calciferol, and it must first convert to calcidiol in the liver, and then it travels to the kidneys where it's converted to calcitriol, or the active form of vitamin D. It has several and really important roles in your body. Most people associate vitamin D with bone health, and vitamin D helps your gut absorb calcium and supports bone mineralization, bone growth, and bone remodeling, all of which are very important. It also plays a role in lowering inflammation in the body, which is obviously very important for autoimmune diseases. Vitamin D also supports cell growth. It supports the immune system, which is also important, glucose metabolism, and neuromuscular function. So what does a deficiency look like? Well, in the classic and most extreme deficiency signs are rickets in kids and infants. And it's basically where their bones aren't formed properly and they're very soft. So they tend to get very bowed legs. I don't know how to say that properly. Or osteomalacia, which again is soft bones in adults. People who have osteomalacia generally complain of things like bone pain, muscle weakness, increased risk of fractures, fatigue, and stiffness. Other signs of not so extreme deficiencies include things like fatigue and weakness, mood changes, hair loss, slow wound healing, and weight gain. When it comes to autoimmune diseases, most people who have inadequate vitamin D levels will see an increase in their disease activity, and this is across many different autoimmune diseases. Additionally, low vitamin D status is a risk factor for developing autoimmune diseases. And remember, if you have one, you are more likely to get another one. So keeping your vitamin D status at a good, healthy level is super important. Other thing to note is that there are several medications that interfere with vitamin D production and absorption in the body. And the first one I want to talk about are statins, because I feel like a lot of people are on these. And really the goal with statins is they reduce cholesterol production in your body. However, when you get vitamin D from sunlight, it requires cholesterol in your body in order to be absorbed. So that when you take a statin, it's going to lower your body's ability to absorb vitamin D from sunlight. In addition, some statins compete with vitamin D for the same metabolizing enzyme. So while it can also lower your vitamin D status, it could also interfere with the efficacy and how a statin actually works in your body, and it might actually work against it. So you do have to be very careful when you are supplementing with vitamin D and taking a statin. The next one are steroids. Again, steroids are often prescribed to lower inflammation in autoimmune diseases. However, as most of you know, steroids, and this includes things like prednisone, they lower calcium absorption. And so obviously when someone is taking a steroid, we are concerned about their calcium status and their bone status, but that also is going to affect your vitamin D metabolism and how that affects your body. So again, something to keep an eye on if you're taking a steroid. And then lastly, thiazide diuretics. They work to lower urinary calcium excretion. And if you're on one of those medications and taking vitamin D supplementation, it actually may increase calcium levels in your body and lead to something called hypercalcemia. where you can get the hardening of arteries actually. So that is not something that you want. So again, please keep an eye on your calcium and vitamin D levels when you're taking any of these medications. All right, so how do you maintain optimal levels in your body? Well, since vitamin D is a fat-soluble vitamin, this means that it stays around in your body for longer than water-soluble vitamins. Water-soluble vitamins you tend to excrete. If your body doesn't need it, it will excrete it pretty much immediately. But with anything that's a fat-soluble vitamin, it is stored in your fat cells, so you don't excrete it as easily. So your risk of toxicity is definitely higher than taking like a water-soluble vitamin. So because of this, it's important to know what your vitamin D status is before starting any supplementation regimen. So before you do anything, please go get your levels checked. It's a simple blood test and any doctor can order it. And according to kind of functional practitioners, the optimal level of vitamin D, and that's the vitamin D test that you're going to get, is the 25-OHD. There's lots of other ones, but this is the one that best tells you your serum levels in your body. You want it to be around 50 milligrams per milliliter. Normal ranges on a lab test will range all the way from 30 up to 100 nanograms per milliliter, but ideally you want around 50 nanograms per milliliter. 40 to 50 is kind of like the good range. Sunlight is the most effective way and most effective natural way to raise your vitamin D levels. Depending on where you live and how dark your skin is, you may need varying amounts of direct, non-sunscreened sunlight. The National Institutes of Health recommend 5 to 30 minutes of sun exposure a few times per week. And again, depending on what time of day you go out in the sun, if it's in the morning before 10 a.m., you're going to need more exposure time versus like middle of the day where the sun is very strong, then you won't need as much exposure time. Supplements can also be really beneficial. Vitamin D comes in 2 different forms that you'll find, D2 and D3. D3 tends to increase levels more efficiently than D2. However, if you have optimal levels, you can either take D2 or D3. It really doesn't matter. I generally recommend that people combine D3 with K2 to better support bone health and vitamin D absorption. And they do make that as a combined supplement, so you don't have to take 2 separate supplements. You also want to aim for supplements that are in a capsule form, but in that I mean it's like a powder that is inside a like dissolvable capsule. Those are usually better broken down and absorbed in your body than solid tablets, which you typically find at the drugstore. And again, please make sure you're getting high quality supplements from brands that test, and so you know exactly what is in them. And there are definitely different certifications. If you need recommendations, I can give you those as well. So just to recap, today we focused on vitamin D, what it is, what a deficiency looks like, why it's important for people with autoimmune diseases to make sure that your D is at an optimal level, how to check free levels, and then how to maintain optimal levels. If you have any questions or you are looking for help managing your autoimmune disease, please reach out to me. I do have a link in my YouTube profile to book a free discovery call. I also have a website where it's linked there and you can find me that way. I've got lots of great materials on my website. I have a very extensive blog. I have some free downloadable guides, so please go ahead, check that out. I also put out a weekly newsletter that comes to your inbox every Thursday if you're interested in that. And lastly, if you do not subscribe to my YouTube channel, please hit the little subscribe button. I do try to be consistent with these videos, although summertime, schedule's a little bit off, but I do try to put these out every week. So please subscribe and watch my videos. Hopefully it's all information that you need to live better with your autoimmune disease and use diet and lifestyle as a very effective tool. So thanks for joining me. Again, my name's Annie. I'm an autoimmune dietitian, and I will see you next time.